Wanted to get your thoughts on this. What do you think is the future of, generally you're a part of the patient analytics category, but
Mhm.
more you can be more specific for, preterm infant care. I mean, what do you think is the future of preterm infant care? And then what do you see that other people don't?
Yeah, and I think a lot of people in our field see what we see. The problem is I don't think they've ever been offered tools to do it. It in many people's mind, it's a small market, no pun intended, right? But 380,000 babies are born preterm, only 10% of the population. So I think what we've done well is focus on a market that's very addressable, high need. But I think for us as a company, when I step back, I think the idea of starting and staying healthy. So using things like nutrition as a very simple way, if you will, to create long-term health, right? Early in life, your immune system gets set, growth, neurodevelopment all takes place. And all that's driven by what you eat, how you're cared for, et cetera. So if we can control those things, kids get a much better start in life. So for us, the way to do that is to inform it with high quality data and large amounts of it. And I think that's maybe the fusion of those things is what we saw. There were a lot of groups doing, I'll call it pure analytics. What are the pathways by which patients go? And in our other side of our world, there were a lot of people looking at, microbiome and probiotics and what to do. And we've kind of come at it from fusing those two data and saying, when you do this, what happens here and how do you bring those two together? And NIH has actually put out a precision nutrition roadmap for the next 10 years that I think is phenomenal, really giving better data of it's not just calories, it's not just keto, it's not just gluten-free, it's you have to be more sophisticated, right? And so the way to do that is large data sets. And that's what I think we see. I don't think we're necessarily alone, but certainly in our patient population and in early life, we've been at the forefront of this. And I think this is keeping kids healthy, giving them the best start at life, and informing decisions with high quality data is the future of health and hopefully will prevent chronic conditions. All of our kids having food allergies, just the things that are sort of plaguing kids today, using data and high quality information to do, to kind of get ahead of bad health and prevent it. That's kind of our vision.